Our next guest has quite a resume. He's been our nation's top doc, a trauma doctor in Tucson, a professor at the U of A, and a member of Pima County's SWAT team. Now he's focusing on you.
Well, if you ever end up in a hospital, you assume that you're in good hands, right? Well, March is National Patient Safety Month. Dr. Richard Carmona is here to tell us how you can make sure you are getting the proper assessment and the proper treatment when you're in the hospital. Hi, doctor.
Hey, Sally, Heather, nice to be with you. Thank you.
We're so honored. You were telling us before the show that your work now is global and that you still live in Tucson, but you're hardly ever here.
I travel a lot. You know, ever since leaving the Office of Surgeon General, a lot of opportunities have opened up, but I do a lot of the same things I did as Surgeon General.
Well, tell us about, I think people are unaware that we have such a thing as preventable patient death. Tell us what that is.
Well, these are caused by medical errors. You know, it's a very busy hospital, a clinic, people are moving in and out, and things that you take for granted sometimes fall through the cracks. So, you know, every year we have thousands of people that are injured and die needlessly because they get the wrong medication, okay? We have people that sometimes get the wrong leg amputated, okay? So there's been a lot of movement, and this patient safety movement organization that Joe Chiani started a number of years ago is addressing those issues. Let's see how we can identify the risks and eliminate them so patients are much more safe within the hospital environment.
Now, I mean, what are some of the challenges that hospitals and patients face? I mean, there must be so many.
There's a lot of them. You're right, Heather. And part of it is just the moment you enter the hospital and you're going to be admitted, you have to be thinking, well, where am I going? What bed am I going to be in? Do they identify me correctly? Am I sure I'm going to get the right medication? Am I going to get the right operation? And we take those things for granted, but in a busy institution, when you see these data reported, things still fall through the cracks. People are still injured. We have people that die because of that, and as well as hospital-acquired infections. That IV that's put in, you get an infection, it keeps you in the hospital longer. If you're ill already and you're older and you don't have the reserve, you might die from that. So again, looking specifically at each of these areas, identifying the variables, and raising awareness with the public so that they ask the right questions, because they need to be part of the solution as well.
Now, you mentioned having the wrong leg amputated, and I think that some people think, oh, that's a rare thing, but you said that actually happened in Tucson.
It's happened in Tucson, it's happened in most large cities, you know, and again, not making excuses for colleagues, but you have lots of people coming into the operating rooms, they're in a holding area, they're getting pre-op, you know, and now what's happened is in most hospitals, they'll actually put a big X on the leg, okay? Right. And the nurse will come in and they'll identify your bracelet. They'll actually barcode all your medications. So when you look at what's happened, it's all good because we're eliminating that risk. But people have to be aware that there's a human element. Even though we have all these great systems and great medicine and great operations, there's still a human element involved, and that person may be tired that day, that person may forget something, so the public has to be aware and ask questions. We want to improve the health literacy of the nation. That is, make sure people understand the complexity of the system they're going into, but have them be a participant.
Mm-hmm. So it really is a patient's duty to speak up at every opportunity.
Yeah, I think so.
Every doctor, anytime you see a new doctor, maybe remind them of any pre-existing issues, medical issues that they have.
Your history is important once you're in the hospital, and let's, as an example, if we're looking at surgery or we're looking at you're being admitted for some reason, there's no reason that the patient shouldn't ask, are you sure that's my medication, okay? Has the bracelet been checked, okay? Is there another person with a similar name in the hospital like mine, and maybe I'm getting the wrong medication? There are little things that we take for granted that can sometimes slip through, but if the public is made aware and they ask those questions, you help the health professionals to ensure that you get the best timely care.
And sometimes you have to do that for an older relative. I mean, because older people will just go, I thought I just took my medication, and not really know.
It's true. It's true. You know, medication errors are important. Many of the errors are actually from what we call handoff communications. So about 80% of those, and that is, if I'm working my 24-hour shift as a trauma surgeon and I go off in the morning and I have to give report to the person taking over who sees the patients a day, have I remembered to tell them everything? Mm-hmm. Did they know what medications I gave, what operation, what complications? Sometimes in that lack of communication in the handoff, something falls through the cracks. Somebody it may just be result in extra tests that you don't need, but what if it's the wrong medication? What if it's the wrong operation? What if it's the wrong plan that's attributed to you? Mm-hmm. So an informed population asking the right questions helps our medical professionals to ensure that there's no errors.
Perfect.
Well, you were just at a huge summit.
Yes.
The International Patient Safety, Science, and Technology Summit.
Yes.
And there were some impressive people there with you. And you have some pictures.
Yes, we do. President Clinton and I were there as keynote speakers, and there were a number of elected officials, senators, and we had world health leaders as well. And this is an annual meeting that brings together leaders in health and science and technology to point out what the risks are, to point out what we have found out that we can apply to everyday patient situations in hospitals and clinics and so on to reduce the risk. And this is Joe Chiani, who runs Massimo, which is a scientific technology company that makes monitors that watch you in the hospital. But Joe said, even with my great monitors, we should be doing more because the monitors aren't enough. People have to interact so we can reduce the morbidity and mortality. So Joe started this organization. It's global now, meets every year, and the purpose is to eliminate all patient preventable death by 2020.
Zero.
Wow.
Zero.
Do you
No
really
more deaths.
think we can do it?
Well, we're going to work hard. Joe's a very ambitious, passionate person, and if we can get the public involved, if we can raise awareness, I think it's certainly possible. But if we don't make the 2020, at least we've continued to eliminate preventable death. And let's not forget, it's only death. It's not only death. It's complications. You stay in the hospital longer, healthcare costs go up. You may end up with a permanent disability. So there's a lot of reasons besides death, even though death is absolutely very important, but we want to do it for all those reasons, to reduce all the morbidity and mortality and keep the cost of healthcare down at a time when we desperately need that.
Exactly. Can you quickly tell us how viewers could get involved?
Well, the Patient Safety Movement organization, you can go online, you can just Google it. There's a website. You can go there and find more information and then join in your own community. A lot of communities have actually bound together through volunteerism to get these words out. There's a lot of groups that are involved with health literacy as well as science and technology. But the first thing is find out more about it, and then as a citizen determine how do you want to be involved to improve patient safety.
Dr. Richard Carmona, thank you so much for stopping by, for squeezing us in your very busy schedule.
Thanks for the opportunity, Sally and Heather. Pleasure to be with you.
Thank you. And to learn more about the Patient Safety Movement, just call 877-236-0279, or like the doctor said, go online to patientsafetymovement.org.
And don't go anywhere. The Morning Blend will be right back with Amanda at the California Adventure in Disneyland.